Emergency medicine begins when somebody gets ill or injured. It really begins when somebody then calls 911 or they decide to go to the hospital or whatever. What we deal with and what our professionals deal with are the people that have called 911 and they have an emergency and somebody comes to them. They do the same medicine that occurs in the ER, but they do it in people's houses. They do it on bathroom floors or in kitchens or outside. They do it under really tough circumstances. They're trained professionals that have a great amount of knowledge who are actually experts in pre-hospital emergency medicine. That's different than emergency medicine. The rest of emergency medicine, same medicine, just a different place.
Well, medical emergencies happen everywhere, anytime. It's important to realize that in order to provide proper care, we have to bring technology with us. Seminole County uses some of the latest technology along with the latest evidence-based medicine to provide the best care possible to the citizens of Seminole County. Not only is the human component important as our EMTs or paramedics, they have to have the knowledge base, the expertise, and they have to bring along the technology that will help and provide that best care. With the goal in mind, again, is to bring the patient to the hospital and giving and maximizing their potential for survival.
One of the questions that we're often asked is, why did a fire engine and an ambulance show up on my medical emergency? And time is of the essence in many of the situations that we encounter, whether it be a medical call, some type of a stroke, heart attack, or trauma. And everything we do is based on doing it as fast as possible. When those units show up, everybody is trained, and there are enough people there to do what they need to do as fast as possible. And I like to equate that to thinking about a pit crew. And when a car comes into pit road, everybody on the team has a job. And their goal, their collective goal, is to get the car back on the track as fast as possible. Our collective goal is to get the patient to the hospital as fast as possible.
My most memorable moment had to be my first pediatric death. And that first child that I wasn't able to resuscitate made a huge impact on future career decisions. It also made me realize how fragile life can be. It's been nearly a decade and thousands of patients later, and to this day I can't hear that child's name without thinking of her.
Recently we had a childbirth. We arrived on scene and dispatch had instructed the father on how to deliver the baby. The baby had just been born. There was a Nike tennis shoe right beside the baby, and I went to move it out of the way to keep the area clean, and when I moved the tennis shoe, the baby jerked. Dispatcher told the father to use a shoestring to tie off the umbilical cord, which he did, but he didn't take it off of his shoe. Oftentimes we deal with death and destruction, but this was a happy event that turned out really well.
My most memorable call involved animals rather than humans, but there was a fire in a trailer that was carrying greyhounds on I-4, and we were trying to put the fire out and save the greyhounds, and while spraying water, to hear the yelping and the crying of the animals will pretty much be stuck in my mind forever.
One very memorable call involved the elderly gentleman who worked in the deli of our local supermarket. He used to fix our sub sandwiches for us all the time. Got a call one morning for a cardiac problem. Got there, this gentleman was in cardiac arrest. We worked code on him, shocked him a couple of times, resuscitated him. It was a successful outcome, and the gentleman ended up becoming a longtime friend of ours. And then the irony of it all was we found out after this that he was a retired New York City firefighter. So that was a pretty neat call for us.
My most memorable call was of a pregnancy. I was recently released as a medic. I loaded the patient up in back of the rescue, delivered the baby in back of the rescue. Upon arriving to the hospital, the patient asked me to cover her up. I wondered why. Ironically, she was an ER physician at that receiving facility.
My most memorable call was at Station 12. There's a cardiac arrest. A young man went down while playing basketball. Upon our arrival, the park ranger had administered the AED. We continued care there on the basketball court with more shock delivery and ACLS drugs. Transported him to Altamont, and 2 months later, we were reunited at the Board of County Commissioner's office. That was the most memorable call in my career.
My most memorable call was my first shift release as a brand new medic, and it was in the morning. We got called out for a possible childbirth. And we got on scene, and there was this Hispanic woman who did not speak one word of English. 6th child. Got her in the back of my truck. Next thing I know, I'm delivering a little baby boy. First time as a brand new medic.
One comes to mind is a young man that was stabbed in the chest with an ice pick. We found him taking his last breath. We intubated him, started some IVs, started heading towards the trauma center. He went into cardiac arrest on us on the way, and he was stable 2 weeks later. So that 1% trauma codes that do survive, I got to witness one of them.
My most memorable had to have been a chest pain, what I thought was going to be a routine chest pain call. I pulled up to the driveway and I noticed, I'm like, I've been here before. So we went in, we're doing our thing. Then I noticed out the back window, and that's when it dawned on me what I'd been there before. And at the corner of my eye, I saw a little kid, or I saw was not a little kid anymore. At the time, it was a 5-year-old kid that drowned in the pool. The kid was standing next to me to my right, and he was about 15 at the time. And I said, hey, did you fall in the pool? He says, yeah, were you the guy that saved me? I said, yeah, it was us. I said, how are you doing? He said, I'm doing fine. I said, good.
This morning, Boone High School returns to class with heavy hearts. 2 classmates were killed in a terrible crash on I-4. 4 other students were involved in that wreck.
On February 6, 2011, my daughter, Elisa, was in a terrible, near-fatal, for her, rollover accident where she was ejected from the vehicle. I was, and she was, more importantly, treated with such kindness and respect and expertise by the Seminole County Paramedics and Fire Rescue Department and personnel, on-duty and off-duty personnel that were involved in her care immediately, first responders on the scene. I completely believe that without them, her end result, would have been tragically different.
August 16th, 1996, I was on my way home from work and came into a freak hailstorm, hydroplaned, and ended into a pine tree on the driver's side. I ended up with a fractured pelvis and a very traumatic injury to the lower part of my left leg. It's my understanding that they almost had to amputate my leg because of the metal pieces that were impacted into my leg. They were not able to extricate me, and thanks to the tenacity of one of the fire service members, they tried one more thing. They were able to free me at that time without amputating my leg. I was airlifted to the hospital. Fortunately for me, EMS fire rescue responded within minutes. They were able to save my life. That's why I'm here today. After being airlifted, EMS actually came up to see me at the hospital to check on me and just make sure that I was going to be okay.
Yeah, I've probably walked a quarter mile in their shoes and figured out that I may not be the right guy to walk the whole mile in their shoes. I'm an emergency medicine guy all the way down the road, but they do something that's very special and it's very difficult. I'm not sure I want to do the job they do. It's very difficult. My hat's off to them.
I'm very proud of our department's EMTs and paramedics. They're not only well trained, they serve their community with compassion. I appreciate that they are dedicated for life and thank them for what they do every day in serving our Seminole County community.